Hi everyone, this is AP Singh. I welcome you all on my channel Medico's Maharathi. Hope you all are happy and healthy. My dear friends, today we are going to discuss previous year question of anatomy NEET PG 2020. आज हम क्या करने वाले हैं? डिस्कस करने वाले हैं क्या प्रीवियस ईयर क्वेश्चंस किसके एनाटॉमी के एग्जाम NEET PG 2020. ओके, so let's start our today's discussion. Before starting discussion, I want to request all those who are new to my channel, my dear friends, please subscribe my channel. Okay, so let's start our today's discussion. First question: a patient presented with squint in right eye as shown below. Okay, identify the nerve lesioned in this case. What you have to identify? Nerve. Okay, lesioned in this case. So there are four options you can see here, and the correct choice for this question is, what do you think? Oculometer? No. Trochlear? Yes. So the correct choice is B. Okay. Correct choice क्या है? B है. ठीक है, B क्यों है? क्योंकि the right eye is moving or going towards superomedial direction, and it is due to overactivity of oculomotor nerve, and this overactivity is under the control of trochlear nerve, or you can say under the activity of trochlear nerve. So that's why trochlear nerve is correct. Okay, for this superomedial direction movement of right eye. Okay, what is next case? Painless cancerous lesion with inguinal lymph node involvement is due to carcinoma of testis, penis, prostate, urinary bladder. So my dear friends, the correct choice for the question is testis. No. Penis? Yes. ठीक है, पेनलेस कैंसरस लेसन विद inguinal lymph node involvement. Okay, how it is correct? So let's see the detail for the question. Because the drainage of penile skin is lined by, or it is with inguinal and lymph node. So ड्रेनेज जो पेनाइल स्किन का है वो किससे है? इंग्विनल lymph node से. ठीक है, so the penis is correct choice. What is next? Tumor is painless. Okay, you can see here painless cancerous lesion. Okay, so tumor is painless because it does not invade or does not usually cause ulceration or bleeding. Okay, so that's why it is painless. So the complete question is solved here. What is next question? Next question क्या है? Identify the type of cartilage. Okay, so you can see here option A fibrocartilage, articular cartilage, elastic cartilage, none of the above. So my dear friends, the correct choice for the question is elastic cartilage. Correct choice क्या है? Elastic cartilage. Okay, and let's see some points for elastic cartilage. Okay, first thing, it is present in ear pinna. Okay, present का है ear pinna में, and it consists of short single irregular branching elastin fibers. Here you can see the irregular branchings, okay, of the elastin fibers. Okay, what is next question? The upward extension of thyroid swelling is prevented by which of the following structure attached to thyroid cartilage? Okay, so the options are sternothyroid, pretracheal fascia, ligament of Barry, thyroid membrane. Okay, so my dear friend, the correct choice is pretracheal fascia. Okay, how it is correct? So let's see. My dear friends, pretracheal fascia goes anterolateral to trachea. Okay, and it continues posteriorly around the esophagus and as pharynx, and as buccopharyngeal fascia. It encloses which structure? Trachea, esophagus, and thyroid gland. Okay, and the neck muscles. Okay, what is it enclosing? Four structure: trachea, esophagus, thyroid gland, and neck muscles. So the correct answer is pretracheal fascia because it is preventing the upward extension of thyroid swelling. Okay, what is next question? In a preterm baby with respiratory distress syndrome, which type of cell is deficient? So the correct choice for the question, what do you think? There are four options. Okay, and the correct choice is option number 4. Okay, so the baby is deficient with type 2 alveolar cell. Okay, in that case of respiratory distress syndrome. Okay, so because it is only 5% present on the surface of alveoli. Okay, to type 2 कितना percent है? 5%. Okay, and when, okay, what's happened when there is alveolar injury, type 1 cell is degenerated and it is replaced by type 2. So the type 2 is responsible for regeneration of epithelium, and that's how it got deficient with type 2 alveolar cell. Okay, what is next question? Highest oxygen concentration in fetal circulation is at which site? ठीक है, highest O2 concentration in fetal circulation, okay, is at which site? There are four options: superior vena cava, inferior vena cava, right ventricle, aorta. So my dear friends, the correct choice is superior vena cava have very low concentration. Examiner is asking highest concentration, so the highest is with inferior vena cava from current options. Okay, इससे भी ज्यादा किसकी होती है वो अभी बताएंगे आपको, ठीक है। व्हाट इज नेक्स्ट? राइट वेंट्रिकल, ठीक है। सी भी नहीं हो सकता, 55 to 60%। ओके, डी भी नहीं हो सकता क्योंकि इसकी भी क्या है, कम है। ओके, सो द करेक्ट चॉइस फ्रॉम द फॉलोइंग ऑप्शन इज inferior vena cava. Which structure do you think have more oxygen concentration during filtration circulation? That is umbilical vein. Okay, so umbilical vein have highest O2 concentration in fetal circulation. Okay, so from the option B is correct, but examiner, if examiner is giving umbilical vein, then the correct choice will be umbilical vein. What about other structure? Umbilical artery have very low concentration. Okay, it's same like superior vena cava. What is next? A 54-year-old man come to hospital with abdominal pain, jaundice, loss of appetite, and weight loss. On examination of radiograph and CT scan, doctor found a slowly growing tumor in uncinate process of pancreas. Which of the following structure will be compressed by this tumor? ठीक है, following structure: splenic vein, portal vein, superior mesenteric artery, superior pancreatic duodenal artery. So my dear friends, correct choice for the question is splenic vein, no; portal vein, no; superior mesenteric artery, yes, it is correct choice. How it is correct choice? Because this structure, this mesenteric artery pass below the pancreas. Okay, suppose this is pancreas and this mesenteric artery pass below this structure. Okay, so superior mesenteric artery pass below the pancreas, so this structure will be compressed by this tumor. Okay, because this tumor, okay, the doctor found that a slowly growing tumor in uncinate process of pancreas. Okay, and if the pancreas is getting tumor cell, then the artery which is suppressed, that is superior mesenteric artery. Okay, what is next? Nerve supply of shown muscle is, okay, so what do you think, which muscle is this? First you must know which muscle is this, then you can find the nerve supply. So my dear friends, let's see which muscle is this. Okay, first thing, so the supply is dorsal scapular. Okay, now you can see dorsal scapular is supply of which muscle? So my dear friends, it is levator scapulae muscle. Okay, which muscle? Levator scapulae muscle. And levator scapulae muscle is supplied by dorsal scapular nerve. Okay, here you can see the diagram also. Okay, so this is levator scapulae muscle and it is supplied by dorsal scapular nerve, and which other muscles also supplied by dorsal scapular nerve? Rhomboid minor muscle and rhomboid major muscle. Here you can see in this image branches of roots. रूट वैल्यू क्या है? C5. सप्लाई किसको करता है? रोम्बोइड मेजर, रोम्बोइड माइनर मसल्स एंड लिवेटर स्कैपुलाई मसल. ओके, so in this diagram this is not clear, that's why I added this diagram. Okay, what is next question? In a preterm baby with respiratory distress syndrome, which of below lipid would be deficient? Sphygmomyelin, cardiolipin, dipalmitoyl phosphatidylcholine. So the correct choice for the question is option number C, dipalmitol phosphatidylcholine. Okay, correct choice क्या है? C. What is next question? Type of joint marked by arrow. Okay, क्या बताना है? Type of joint marked by arrow. So you have to tell this joint. Okay, so let's see the options. Syndesmosis, syndarthrosis, and symphysis synovial joint. So my dear friends, correct choice for the question is, first thing is that this is costovertebral joint. Okay, पहली बात क्या है, ये जॉइंट कौन सा है? कोस्टोवर्टिबल जॉइंट है. ठीक है, अब कोस्टोवर्टिबल जॉइंट किसका टाइप है? ओके, so first thing is that it is costovertebral joint and this joint is type of synovial joint. So here the correct choice is synovial joint, because first thing is that you must know this joint is costovertebral joint and costovertebral joint is a subtype of synovial joint. Okay, costovertebral joint formed between facet of tubercle of rib and adjacent transverse प्रोसेस ऑफ थोरैसिक वर्टिब्रा. ओके, सो पहली बात, कोस्टोवर्टिबल जॉइंट बनता क्या कहाँ है? ठीक है, हियर यू कैन सी इन दिस एरिया इट इज फॉर्म्ड बिटवीन फेसेट ऑफ ट्यूबरकल ऑफ रिब and adjacent transverse process of thoracic vertebra. Okay, so this scene is of thoracic vertebra and you can see between this adjacent structure this joint is formed, and this joint is costovertebral joint and it is type of synovial joint. What is next question? A patient presented with weakness of right side of face. Okay, there is associated ipsilateral loss of pain and temperature of face and contralateral body. The lesion is most likely to located at, so medial medulla, lateral pons, medial pons, lateral medulla. So my dear friends, correct choice for the question is lateral pons. Okay, how it is lateral pons? So let's see how it is a lateral pons. Okay, first thing you must see here the weakness of the right side of face. Okay, right side of face, it is related to, first thing is that it is related to lateral area. Okay, lateral area. ठीक है, दो ऑप्शन रूल आउट हो चुके हैं. ठीक है, सी बी ए बी. अब बी और डी में से देखना है. ठीक है, so lesion in the pons lead to seventh nerve palsy as seventh nerve nucleus is present in pons leading to ipsilateral facial weakness. Okay, ठीक है, सेवंथ नर्व का जो न्यूक्लियस है वो किस में है? पॉन्स में. ठीक है, तो मेडुला वाला ऑप्शन रूल आउट, ओनली चॉइस बी इज पेंडिंग and it will lead also to sensory impairment of fifth nerve which is present in lateral pons leading to ipsilateral loss of sensation on the face. So the correct choice is lateral pons for the question. What is next question? Remanent of wolffian duct in a female are found in pouch of Douglas, uterovesical pouch, broad ligament, iliac fossa. So my dear friends, correct choice for the question is broad ligament. Correct choice क्या है? Broad ligament. Okay. अब remnant of wolffian duct क्या है? Gartner duct is the remnant of wolffian duct and The remnant, this Gartner duct, is found in broad ligament. So the correct choice is broad ligament. So my dear friends, this is all about our today's discussion. Thanks to everyone for watching this video. My dear friends, I shared 12 questions and some question I already shared in my previous video in quiz time. I shared anatomy question and 2 3 question are very simple one liner question, so that's why I noted them here. Okay, and many question I already shared in my previous video mixed bag quiz question. Okay, in that time I shared approximately 4 5 question of anatomy of previous year 2020, so that's why I shared here 12 question. Okay, so I hope you all like this video, you all like this discussion. My dear friends, the aim is only to provide you these questions which will help you, I hope which will help you little bit or as what you think that, but it will help you for your upcoming exam. Okay, so my dear friends, thanks to everyone for watching this video, and if you feel that this video is helpful, you have to do one thing: share this video with your friends and say them to subscribe my channel. And if till now, till this time, you are not my subscriber, then subscribe my channel and press on notification bell icon so that you can get updates for all important upcoming videos. Thanks to everyone. Stay safe, stay healthy.